Hello everyone, my name is Junior Ndaba and I'll be presenting the Brazil Zika virus outbreak of 2015 to 2016 that happened during the Olympic Games. The Zika virus of 2015 to 2016 was an outbreak of global importance which spread rapidly across Brazil and the Americas, infecting approximately 1.5 million people. To outline the presentation, first I'll talk about the overview of the Zika outbreak, followed briefly by the background of the outbreak and the rationale for selection of outbreak as outlined in the International Health Regulation and One Health perspective. The Emergency Response Framework, WHO 2018, utilized to conduct the critique. Literature review, Zika Strategic Response Framework and Joint Operations Plan, and the Pan-American Health Organization was utilized to identify the key concerns and challenges of the outbreak. This will be followed by an analytical evaluation of the global and national response to the outbreak from a One Health perspective. Lastly, lessons learned will be employed to inform future outbreaks. As highlighted from the beginning, Zika virus was declared an outbreak that constitutes public health emergency of international concern due to its threat to global public health and serious consequences of infection. This declaration was issued on the 1st of February 2016. WHO released temporal recommendation based on the emergency framework to mitigate public health events and emergencies that have the potential to cross borders, thereby instigating alert and rapid response activities already being implemented in collaboration with other countries to control international outbreaks and strengthen international public health security. Due to the human-animal environmental interface, mitigating these emerging epidemics will require multi-sectorial collaborations between numerous disciplines, which requires a One Health approach to understand biological, social, and the environmental determinants of health and disease of animals and humans. Now let's look at the outbreak overview. In 1947, Zika was first discovered from a monkey in Uganda forest, hence the name Zika. For decades, it remained confined in Africa with a small sporadic outbreak in Asia. In 2007, there was a major outbreak in Yap Island affecting 75% of the population and no deaths were recorded. Between 2013 and 2014, we see yet another major outbreak in the French Polynesia with cases of symptomatic patients with neurological disorders. In 2014, the Zika virus comes to Brazil. This was characterized with low-grade fever and rash. Now, the major outbreak of Zika happened between 2016 and 2016 in Brazil. There were 1,384 cases of babies born with microcephaly and other malformations, and 89% of those confirmed cases were from the northern eastern region of Brazil, which is the poor part of Brazil. Now let's focus on the background of Zika virus outbreak. The Zika was known as a mild disease, primarily transmitted by Aedes aegypti mosquito, which also transmit dengue and chikungunya. Some cases of the Zika virus sexual transmission have been reported. Literature reviews suggest that it is possible that the outbreak was not recognized for some time until the increase in case numbers. The rapid spread of Zika virus infections outbreak was extraordinary due to the scientific evidence of the association with complications of infant microcephaly and Guillain-Barré syndrome in adults. These complications pose challenges for public health preparedness and surveillance during the Olympic Games. Congruently, the committee agreed that due to the geographical expansion and the considerable gaps in the knowledge of the Zika virus and its complications, and lack of reliable diagnostic testing and no vaccine, Zika was a virus that was a continued threat to the public health. So what is microcephaly? It is a clinical finding of small head when compared to infants of same sex and age. The head circumference is measured, or the occipital-frontal circumference. This disorder often leads to cognitive and neurological issues. And babies born with small heads or brains often have difficulties in the long term. So looking at this picture here, we can see that there's a baby with a typical head size, then a baby with microcephaly. The head is a bit smaller, and then the last baby has got a very, very small head, and this is a baby with severe macrocephaly. So looking at this picture here, we can see that there's a baby with a typical head size, then a baby with microcephaly. The head is a bit smaller, and then the last baby has got a very, very small head, and this is a baby with severe macrocephaly. So looking at this picture here, we can see that there's a baby with a typical head size, then a baby with microcephaly. The head is a bit smaller, and then the last baby has got a very, very small head, and this is a baby with severe macrocephaly. There were key concerns with the Zika virus outbreak. Babies were being born with microcephaly. There was evidence of Guillain-Barré syndrome in adults. Also, the risk of spread of disease to other countries and territories was a concern. Lack of knowledge of public health implications in terms of long-term complications was also a concern. During this time, there was no reliable diagnostic testing for Zika, and the population didn't have any immunity towards the disease, and there were no vaccines or therapies. So now, looking back at these key concerns of the outbreak, it is evident that the Zika virus and associated consequences represents a highly significant and long-term problems that needs WHO to coordinate and collaborate with global and national partners to ensure member states provide care and support to the families affected by the Zika virus, and also to drive forward all aspects of research agendas in order to strengthen health systems and inform insights into future outbreaks. In response to the outbreak, the WHO, under the guidance of IHR, removed the declaration in November 2016, identifying measures and recommendations to address long-term social, environmental, and economic determinants of health, to strengthen services, and also to promote equity and sustainability. The Zika strategic plan was then employed to support national governments and communities in preventing and managing the complications of the Zika virus and mitigating the socio-economic consequences in the areas of detection, prevention, care and support for at-risk populations, their families and the community, and also to strengthen public health systems capacities. Expansion of health system capacities need to focus on vulnerable populations such as children with congenital malformations, child age bearing women, pregnant women, and their families and communities. There were key challenges identified. Prior to the epidemic, Brazil had a deep foreign policy history of positively responding to international pressures through a stronger policy response to health epidemics. This included practitioners, researchers, doctors, and epidemiologists that were exchanging information in a timely manner. Hence the recognition of swiftly reporting the increase in case numbers of babies born with congenital malformations. So this was when the Minister of Health for Brazil reported a public health emergency in November 2015. Despite Brazil's history of strong response to health epidemics, political and economic instability, lack of sufficient funding can hinder the response in utilizing the One Health models. The strategic response framework focuses on mobilizing and coordinating partners to assist affected and risk countries across 3 areas, which are surveillance, response, and research. These challenging political and economic conditions have contributed to a reduction in SARS funding, consequently contributing to poor quality care for women and newborns affected with Zika. Research reveals that many countries do not have limited systems for routine surveillance, case detection, and reporting. Even in settings with laboratory capacity, case detection and surveillance systems are challenging due to limitations of available diagnostic tests. What are the lessons learned from the Brazil Zika outbreak? Children with congenital malfunctions are disproportionately born to women and girls of low socioeconomic status, and those children will have long-term issues of disability such as intellectual, physical, and sensory impairments, and solutions should be targeted to full range of the disease. A coordinated international response is needed to improve surveillance, the detections of infections, congenital malformations, and neurological complications, and also to intensify the control of mosquito populations and expedite the development of diagnostic tests and vaccines to protect people at risk, especially during pregnancy. Vector control measures should be in place. Currently, there are no viable Zika virus-specific vaccinations or treatment available. Therefore, the vector control is still the primary method for the control and prevention of mosquito-borne diseases. But it is not all gloom and doom. In Recife, a massive trap intervention was implemented for 2 years with population suppression of about 90% of sterile mosquitoes. In the future outbreaks, early reporting and detection is important. vaccination and treatment to develop immune response modalities is crucial. It is important to strengthen health systems and also to respond to outbreaks in a timely manner. It is important to generate new tools for vector control and share information. In conclusion, the complexities and challenges of the Brazil Zika virus have highlighted the importance of One Health perspective of multi-sectorial collaboration and approach in response to emerging and resurgent arboviral diseases. Thank you for your time and for listening to my presentation. Thanks.